question number one comes from Dana Caraban on Twitter at KidCara, Kidcara. How would you prioritize the supplements that you take is the question that they asked. So this is a very good question. I know supplements are a very hot topic these days. A lot of people are taking them, but we know it's a very unregulated industry. People don't know which ones they should take and which ones they should take for a particular reason. But what I would say is that you should prioritize your goals first before you prioritize your supplements. If you only have so much money to spend on supplements per month, what you need to do is you need to spend that money where it's going to get the most bang for your buck or where it's going to make the most impact on your overall health. For a lot of people, that may be cardiovascular supplements that may improve your overall risk for cardiovascular disease. And I'm going to go into those in a minute. At the same time, other people don't have too much interest in reducing their cardiovascular risk. Maybe you're just a 25-year-old who was pretty healthy, doesn't have any family history. Like at this point, keeping all your lipids in check, you make sure your blood pressure is low is something that's easy to do just because of your age. Not necessarily for everybody, but for some people. So like for me, for example, I tend to lose muscle fairly easily. If I don't lift weights and eat a ton of protein, then I tend to lose muscle. So for me, I always prioritize protein, so whey protein. You want to get it from a really good source. Grass-fed whey is what I usually use. And I'm usually having 2, sometimes even 3 scoops a day. So that's going to be anywhere from 50 to 70 upwards, maybe 80 grams of protein per day that I add. And so the reason being is that for me, if I don't get enough protein, meaning about 1 gram a pound per day, I just start to lose muscle. And for me, again, it's a big priority not to lose muscle, maintain muscle mass. And so whey protein is a big one for me. Another one is creatine. And creatine, fortunately too, is relatively inexpensive. I take about 5 grams per day. I have experimented with going up to 10 grams a day. I haven't really noticed too much of a difference though, when I've gone up. A lot of people are wondering too about BCAAs or branched chain amino acids. I have taken those before, but I have been taking them actually probably over a year now. I've posted about it as well because there has been some research that has come out that has shown that they're actually not that beneficial for reducing DOMS or delayed onset muscle soreness or for reducing muscle loss like during periods of caloric deficit or anything like that. For me, again, one of my priorities is to maintain muscles. A ton of protein, whey protein, and creatine are things that I think can potentially retain muscle mass. HMB is another one that has some pretty decent evidence for retaining muscle mass as well. There may be some other things that work out there. I'm not saying that they don't. Those are the ones that stand out to me, and those are the ones that I supplement with. The only other thing that I would mention is sometimes before workouts, I do use citrulline malate, which can potentially increase vasodilation, give you a little bit better pump, that kind of thing. I don't know if there's any evidence for necessarily increasing overall muscle. If you want to increase muscle, the biggest things are lifting weights, strength training, progressive overload, try to get a little bit stronger over time. Eventually you are going to max out at some point, everybody does. And then also to maintain your protein. That's me. That's one of the big areas I need to focus on. For some people though, it might be cardiovascular disease, and it should be. Cardiovascular disease is by far the biggest killer in North America. Like cancer is second. It's not really even close. It's cardiovascular disease. It's definitely the biggest one. And so some people we want to prioritize that over everything else, considering that's going to be the number one thing that's most likely to kill you. Again, I'm just speaking in like a general broad sense. If you have severe history of some of cancer, you may be predisposed to cancer. But in general, again, cardiovascular disease is what causes the most death in people in North America. For those things, people ask me a lot about red yeast rice. The reason being because red yeast rice has been shown to reduce your LDL, your low density lipoprotein, or your so-called bad cholesterol, even though it's not technically a cholesterol, it's a lipoprotein. In terms of supplements for this and the red yeast rice, it's hard to say if this is even a supplement because red yeast rice is actually monocolin K, which is luvastatin. So you're essentially taking a pharmaceutical drug when you are taking red yeast rice. You're going to get all the benefits that you get from a statin So statins, again, are the most commonly prescribed medications for lowering cholesterol. But if you are taking red yeast rice, you're going to get the same side effects. So that could be increased liver enzymes, could be muscle pain. All the things that come along with taking statins will come along with red yeast rice. So just something that I want to make people aware of. A lot of people bring up bergamot or bergamot. I'm not really sure how to say that, to be honest. And it's just mixed evidence for this. I have seen some studies that said that it's been effective. Others have shown that it's not been effective. I think there was a meta-analysis done fairly recently. It was either like 2022 or it might have been 2020, but it's fairly recently, within the past few years. And they said at the end that there was mixed evidence for it. So again, some trials say that it works, some trials say that it doesn't work. Something that you can try. And then if you try it for 3 months and you see a big change in your lipids, meaning that get blood work done, and not to go off on a tangent, but if you're not getting blood work done and you're trying to lower something that can be lowered or that can be measured objectively on a blood test, you're basically just doing guesswork, right? So it is important to get an objective measurement. So to get a good lipid panel done, also to get an ApoB, a one-time LP(a) is good as well. And I can come to back to that in a sec. But for a bergamot, that's what I would say again is take it if you want. After 3 months, if it's not making any changes for you, stop it. If it is making changes for you, great. You can keep taking that. Garlic is another one that gets brought up a bit. There is some evidence for garlic that can help. You're not going to see dramatic changes like with statins and things. And I'm not trying to say you should, definitely take a statin. I'll get back to statins in a sec. With regards to taking garlic, expect maybe 10 to 15% changes in your cholesterol or your LDL, your HDL. Don't expect it to reduce it by 50%. If you're at 5.00 millimoles a liter, it might come down to 4.5 or something like that for your LDL. It's not gonna reduce it drastically. Niacin also gets brought up quite a bit, which is a very interesting supplement to me. So niacin is just vitamin B3, and it comes in 2 different forms, as a flush and a non-flushing form. The evidence that shows that niacin may work comes all in the flush form and not in the non-flush form. Some people find the flushing to be incredibly uncomfortable. And if you do take 1,000 milligrams of niacin, you've never taken it before, even sometimes 100 milligrams, like it can seem like you're breaking out in like the worst rash of your life. Like your body will have this red rash on it for about 15 to 20 minutes from the vasodilation that it causes. And so some people find that to be very uncomfortable. I'm a big weirdo. I actually like taking niacin and even getting into my sauna. I like the niacin flush. I think it's awesome. But again, I think I'm maybe 1 out of 10 people, 10% of people that do like the niacin flush. Most people don't like it. But again, the studies that show that niacin can be effective for reducing triglycerides, improving your lipid profile, seem to be in the flush form, not in the non-flush form. That being said, there was a Cochrane review in 2017 that showed that niacin was not effective overall for primary prevention of cardiovascular events or reducing mortality. Again, very strange because we have some mechanisms of action with niacin. Again, the lipid lowering, there's also studies that show that it actually decreases or improves endothelial cell function, which again would lower your risk for cardiovascular disease. Something, again, that I think that you should get blood work done on when you're taking it. And just one last thing on niacin before I go on that's pretty interesting. So I mentioned something briefly earlier called LP(a). So this is a new cardiovascular parameter that a lot of people are looking at these days. Dr. Peter Attia actually addressed this in his book, Longevity, which I tore apart for, 30 to 40 hours. I didn't just read that book. I studied it, underlined it like crazy. But one thing he did mention in the book was that in order to lower LP(a), again, a cardiovascular parameter that we measure to lower cardiovascular disease, is that it can't be lowered very easily. And he said the only thing that could actually lower it was a PCSK9 inhibitor. So these are newer lipid-lowering medications, and Peter actually takes one himself. He said that that's the only way to reduce LP(a), and it reduces it by about 30%. But if you look at niacin, I did see a randomized, or sorry, even a meta-analysis. I think there was about at least 6 or more randomized controlled trials in that showed that it actually can decrease Lp(a) by 23%. And maybe that's something that just didn't come up on Peter's radar at the time. Again, have really great respect for Dr. Peter Attias, but with the niacin, I think there may be something to that. If you do have a high Lp(a) and you're looking to lower it, but you don't want to go on a pharmaceutical drug, niacin might be able to lower it again by about 23%, which is not that much different than the 30% from the PCSK9 inhibitors. So I think maybe it's time to move on to something else, or another hot topic regarding supplements, and that'd be anti-aging supplements. That's a super hot topic these days. Dr. David Sinclair, in the last 2 or 3 years, has really popularized increasing people's NAD+ levels. There's been some animal model studies that have shown that we do have decreased NAD as we get older, and that this may be something that we could prioritize in elevating in order to reduce aging, or the entire aging process. So the big supplements that Dr. David Sinclair recommends, as far as I know, for increasing NAD are NMN and NR. And then also niacin, interestingly as well. So I'll come back to that in a second. What I'll say about this is that there's no real hard evidence that if you're taking these things, then it's definitely going to decrease your risk of aging. Dr. Sinclair put out something recently showing that if you took NMN for a certain amount of time, it increased the length of time that people can walk. And that was a very interesting study. Dr. Peter Attias' take on that was that it didn't really prove that it would necessarily increase the aging, decrease the aging process. And I'm taking a bit of a cautious approach with this as well. That being said, there doesn't really seem to be any detriment into taking it. And some people, again, it's all mostly anecdotal for right now, but some people have found some improvements in their overall energy, well-being, ability to exercise. And again, there just doesn't really seem to be any kind of downsides to it. For me, I think that if you want to take them and you can afford to take them, you can. But in terms of something that has hard evidence, I can't really say that any of the precursors for NAD+ definitely have evidence that will definitely decrease your rate of aging. That's how I think you should prioritize your supplements, again, is just your most important goal. And so what is your most important goal? And then focus on the supplements that can improve that particular goal. And one good resource, actually, if you ever want to do research supplements, is examine.com. They have a great database. You can basically type in any supplement in the world, more or less, and they will give you all the studies that relate to that supplement and whether or not it is in fact effective. Again, that's my general approach, but I think I've spent enough time on that one. But thank you so much again, Dana. I do appreciate that question. If someone does have any follow-up questions about that, please comment on this video, or just please let me know how you'd like me to answer it.